When a student begins exhibiting intense, agitated behavior, it triggers an immediate alarm for everyone around them. The collective instinct is often reactive. Society struggles to categorize the student, attempting to fit them into a preconceived psychological or demographic profile of a future threat. This document from a federal research initiative highlights a crucial fact. The variety of school attackers makes creating an accurate profile impossible. Trying to match a distressed student to a list of assumed traits can shift attention away from hard evidence. This creates a diagnostic challenge. Administrators and counselors must determine how to accurately distinguish between a child crying out for help and a child actively planning an attack. When schools focus on traits instead of evidence, they risk missing actual danger while misinterpreting common signs of childhood distress. Distinguishing between a cry for help and a plan for violence requires an evaluation based on facts, not fear. The first step in that evaluation process is checking for signs of trauma or abuse. The behaviors that often alarm schools, sudden outbursts of anger, deep sadness, or intense defiance, are frequently the same symptoms a child exhibits when enduring a traumatic event at home. Medical and psychological professionals examine the student for specific physical indicators of non-accidental trauma. They are looking for injuries that look different from the normal scrapes and bruises of childhood. This clinical infographic details the 10-4 Faces P rule, an evidence-based screening tool used by doctors to identify potentially inflicted physical abuse in younger children. By tracking unexplained bruises in specific vulnerable regions, like the torso, ears, and neck, doctors can trigger a child protection intervention. The second diagnostic filter addresses mental health. A persistent cultural myth claims severe mental illness is the primary driver of targeted school violence. This chart visualizes data from an FBI study on pre-attack behaviors. It shows that only 25% of active shooters had a verified mental illness diagnosis. A medical diagnosis is not a reliable predictor of violence. When evaluators uncover trauma or psychological distress, they flag those issues for clinical support. These are markers of a student in pain, not a student moving toward an attack. This protocol focuses on specific actions rather than identity. Developed initially by the U.S. Secret Service, evaluators move past analyzing who the student is to document exactly what they are doing. Evaluators are trained to identify the difference between a verbal threat made out of temporary frustration and a student posing a threat by engaging in concrete actions. Federal research, including an FBI analysis of 63 active shooting incidents, documents the precise physical markers preceding these events. The data shows targeted violence is a chronological process. Shooters rarely snap. They spend weeks or months visibly planning. Evaluators look for primary indicators of risk: procuring weapons, conducting site surveillance, and a phenomenon known as leakage, where an individual reveals their violent intent to peers beforehand. Threat assessment teams look to see if these specific actions occur alongside an accumulation of stressors, like a major interpersonal failure or a profound sense of hopelessness. Tracking these observable actions helps schools identify individuals on a pathway to violence before they attack. The threat assessment process operates as a fact-based intervention, designed to resolve the underlying problem driving the alarming behavior. The primary goal of a school's multidisciplinary team is to step in, disrupt the planning cycle, and move the student onto a pathway of care through therapy, mediation, or social support. These teams rely on the community. The FBI found active shooters average 4 to 5 concerning behaviors visible to others. Yet when witnessing these warning signs, bystanders commonly do nothing. Friends and family often hesitate, afraid of wrongly accusing someone they care about. Reporting concerning behavior allows school teams to recognize a student in distress. It creates an opportunity to evaluate behavior in context and intervene before distress becomes a tragedy.